On Friday, December 18th, Oakland County Executive Dave Coulter hosted a press conference at the Waterford Township Regional Fire Department headquarters, where the first doses of the COVID-19 vaccine were administered to emergency medical service personnel. The vaccine arrived on Thursday, December 17th, and the first vaccination was given to Steve Cooper, Director of Public Safety for the City of Oak Park.
It must have been a luck of the draw. I got up early this morning. I was obviously excited about coming and getting the vaccination, and as I was talking to some colleagues and some others, that we've been in the COVID pandemic for so long now. I think it's very important that we try and get on the other side, the downside of it. I was happy to be first. I trust and I believe in the science. I think it's very important that many others get vaccinated so we can get back to a sense of normalcy that is more conducive.
100 doses of the vaccine were administered at the Waterford Township location, with similar events scheduled to take place throughout Oakland County in the coming weeks.
This vaccine can't come soon enough. In fact, I'm very sad that it didn't come soon enough for people like Benny Napoleon and the many other people who have been affected by this vaccine. Yesterday marked a milestone in Oakland County, and not a happy one. We now have over 50,000 Oakland County residents who have contracted COVID-19. Sadly, more than 1,400 of those have passed away from this virus. And even though we're excited today that we're beginning the first phases of the vaccination rollout, we know that this is going to take time. We know we need more doses of the vaccine.
Medical Director Dr. Russell Faust reassures the public that this vaccine has been a work in progress long before COVID-19 impacted the world.
After having phases 1, 2, and 3 clinical trials, the Pfizer vaccine has gone through tens of thousands of volunteers and has been, during that trial, an extremely safe vaccine. And many people are concerned that it was, quote, rushed to market. In fact, we were very fortunate in that the mRNA aspect of this vaccine was actually in development over decades, and in fact had been under development for SARS and MERS and Ebola viruses. And in fact, they were able to develop upon those existing methods and simply use the mRNA for the spike protein of SARS-CoV-2 or COVID-19. So that moved them ahead by many years, and were able to bring it to us in less than a year. So that's wonderful. And the efficacy is 95%. That is, comparing those treated in the clinical trial to those that got a placebo. And that was a completely blinded, it's called blinded trial. That is, the vaccinators and the recipients had no idea. They volunteered for the trial, no idea whether they were receiving the vaccine or receiving the placebo. And it had a 95% efficacy in reducing the treated group in contracting the virus. That's incredible and a fantastic success.
Phase 1A of Oakland County's vaccination plan includes those serving in healthcare settings who could potentially be exposed to COVID-19. Phase 1B includes workers in essential and critical industries. Phase 1C includes those considered high risk due to underlying medical conditions or are 65 years of age or older. Phase 2 includes all individuals 16 years of age or older and will most likely be rolled out in the spring. In Waterford Township, this is Joe Johnson reporting for ONTV News.